Well, good morning, everybody, and welcome to Cancer Support Community Central Ohio's Natural Living Workshop with community herbalist Lily Kunning. We're so thankful that she provides these fabulous education sessions for us. And today she's going to be talking about the natural medicine cabinet. So welcome, Lily.
Hello, everybody. Good morning. And yeah, I do want to apologize for the peeping noise. I hope it's not too distracting. The baby ducks and geese are a little too small to go outside right now, so they're partially in my office. So I apologize. So today we are going to talk about building a natural medicine cabinet, finding natural, herbal, and non-herbal alternatives to some of the common things that most Americans have in their medicine cabinet, and why we should possibly avoid those things, right? So I'm gonna share my screen really quick. Can everybody see that? Great. All right, so I am a clinical herbalist. I do a clinical practice and teach classes like this one, and I formulate for Haven Herbs, who allows me to be here and take time away to do these classes every month. So Haven Herbs is my little apothecary. So one thing that you should know is natural remedies, herbalism is what my forte is, are just as or even more effective than the things that you can buy in the corner drugstore. And many of these remedies or tonics, I will get to the difference in a second, don't just do symptom management. Symptom management is important, right? When you're feeling poopy, you don't want to feel poopy, right? But we want to get to the root cause to eliminate the reason for the affliction in the first place, right? So when people say, oh, I have a headache, right? Yes, a headache is a problem, but it's also a symptom. What is the root cause of that headache? What kind of headache is it? Is it a migraine, and what kind of migraine, right? Migraines can be caused by hormonal imbalance. They can be caused by inflammation around the trigeminal nerve. They can be caused by lots of different things, misalignment of the spine. And getting to the root cause eliminates the reason for that headache, right? And keeps it from coming back. So holistic medicine, which is what I practice, is a way of not just treating the symptoms, that's part of it, but also getting to the root cause. So let's dive right in. The most common thing most people have in their medicine cabinet is some kind of NSAID, non-steroidal anti-inflammatory drug. So these include ibuprofen, acetaminophen, naproxen, and aspirin. And the way that these are made, these are synthetically synthesized, they're synthesized chemicals that are compounded and compressed into tablets or capsules or whatever. Aspirin had its roots in plants, a while back. Meadowsweet and white willow bark are high in salicylic acid, and the way that they used to make aspirin is to extract that salicylic acid from those natural compounds and then compound them into a small dose or a powder. Back in the day, people had aspirin powder. But these are symptom management, right? They reduce inflammation and they are analgesics. They get rid of the pain sensation in your brain. But part of the problem is that people become really dependent on them when they have an underlying condition that is causing continuous pain. For example, my partner has a torn rotator cuff, right? It is painful. And until that rotator cuff is fixed, they're going to experience pain. Now, one of the things that they could do is pop a bunch of ibuprofen every day, right? But that is ultimately going to mess up their digestive tract and their liver. It can cause some serious, like, short-term digestive upset. It can also increase your possibility of heart attack and stroke, which runs in his family, and I'm not about to make that happen. And some people actually get all kinds of proprioceptive problems. They get dizzy, they faint, they have difficulty concentrating, a lack of balance from using NSAIDs too much. Now, that said, I use NSAIDs sometimes. Sometimes you need a quick fix, right? You are down for the count and you need something. But what I do instead most of the time is I have herbal therapies that I use. And I also take tonic herbs to keep the inflammation that happens in my body from getting out of control. Now, the difference between a tonic and a remedy in herbalism is really simple. So remedies are what you take when you want quick fix, like I have a headache or I have the flu, right? Those things remedy an acute situation. A tonic is something that is taken on a regular basis to stay well or to help with a chronic condition, right? So, for example, every morning I put golden milk in my coffee as a tonic. Golden milk is made with turmeric and black pepper and sometimes other things. And it's put in a milk base. I use hemp milk, I think, or oat milk, one or the other. And I put it in my coffee as creamer instead. And what that does is it puts that turmeric, that curcumin and piperine into my body to chronically, like to systemically lower that chronic inflammation. Because, you know, I'm partially disabled. I have inflammation in my body all the time in certain spots. So that's one thing I do to stay flexible and to reduce chronic inflammation. I also do Qigong almost every morning to maintain strength and agility and flexibility and to move Qi through my body to make sure there's no place that's stagnant. So that's what I do instead of taking way too many NSAIDs to manage my condition. And again, at any point, if you have questions about things, either put it in the chat or oh, I see that there's stuff in the chat actually. Let me look at that. It's hard when you're sharing screen, like the menu moves to the top. And anyway, I will look at those really quick before I move on. Get really stiff and sore from my meds, looking for something other than an NSAID that can help. Turmeric, definitely. Qigong. So let me type that in the chat. Qigong is a Chinese medicinal movement practice. So one of the things that happened when I became disabled, when I got a condition from working on computers too much, was that all the fascia in my back froze and it really inhibited my movement and it caused cascading musculoskeletal effects that I still need to work on to this day, even though I am functional, I work on a farm, like all these things, I still need to do some maintenance. So Qigong is one of those things that I do. It moves Qi, which is life force. It's an energetic life force that is in all living things. It moves Qi through the body. It helps you to tonify certain parts of the body with different movements. It is thousands of years old. The one that I tend to do, which is the most whole body, when I need like a whole body stretch, is called 8 brocades, 8 silk brocades. And it is 8 different movements that you do, usually 8 times a piece. And it ties your breath with your movements. It is gentle, and you can see yourself improving as you continue to do it. I've seen my range of motion improve dramatically doing the same movements every day with Qigong. So I'm a big fan of that. I also like Tai Chi. It's a little more complicated than Qigong, and it's less medical and more stretching and martial. But both of those are great. I personally can't do yoga. Like, I know yoga works for a lot of people and it's very great at building up strength and agility and flexibility. But the nature of my injury makes it so that movement is better, continuous movement, rather than having a position and holding it. And that's just me. Like, some people that works really well. So it took me a while to find a movement therapy that worked for me. But yeah, let's move one more. Let's see. Oh, good. Every Thursday at 10:30 on Zoom, there is a Qigong class. There's also gentle yoga and chair yoga on Fridays. That's great. Yes, you will be getting not only the slides as a PDF, but you will also be getting a few handouts about some of the topics that are in this natural medicine cabinet brochure, just going a little bit more in depth. So for pain, inflammation, fever, and cramping, which is why most people take NSAIDs, you can try an essential oil therapy. Make sure that it is a diluted one. That's why I put roll-ons, because those are in a carrier oil and you can apply it to wherever you see blood vessels so that it enters the bloodstream and helps. Herbal tinctures for pain and inflammation. Haven makes one called the Gripes. That is an all-around pain and inflammation reliever. Golden milk, which I mentioned, it is turmeric and black pepper and possibly some other things. I use Haven's turmeric tea paste, which is turmeric, black pepper, and ginger powdered and put in a base of raw local honey. So literally you take a scoop of it, you melt it either with heat over on the stovetop. It takes about 5 minutes in a pan, or you can use an immersion blender and break it all up, and it turns the milk this beautiful golden color. I mean, it's the most gorgeous thing you've ever seen. You kind of don't want to drink it, but it's very good. And like I said, I make a quart of it every week and I put it in my coffee, and that way I know I'm getting it and I don't even have to think about it, right? Like, who wants to take another pill? Blech. So salves for sore muscles. If you've got musculoskeletal tightness, tension, inflammation, soreness, you can actually buy a salve for that and rub it in. And then you're also combining it with a massage. Deep tissue massage is fantastic for helping the muscles and tendons and ligaments restore themselves. Doing a soak with Epsom salt and herbs that are designed for your condition, that also really helps muscles to fix themselves. Herbal teas, I think the one that is shown here, we've got people on top of it. Yeah, it's Moontime tea. So that is a menstrual and menstrual symptom tea for PMS and cramping and all of that. But there are herbal teas for so many things. And, you know, I would encourage you to look or ask me for a specific formula. And the other thing I said is letting a fever happen. So fever is way too overtreated in the United States. The only reason you should take something to bring down a fever is if it's over 102 for over 3 days. Otherwise, let it happen. This is your body's immune system responding to something. Usually a pathogen. And what it's doing is while it's uncomfortable, it's raising the temperature to a safe level for you, but not a safe level for that pathogen. We're trying to cook them and kill them. So definitely don't take an NSAID the moment you see fever, because you let your body do its job. You may be prolonging that illness or making that virus or bacteria stronger because you're fighting your own immune response. Again, if it's over 102 for over 3 days, definitely bring it down, because you don't want to have extended periods of high fever. But if it's just for a day, don't pop an NSAID. The other thing that I want to point out is that botanicals, because there's a whole range of phytochemicals in there that buffer some of the more active constituents, they tend to have less side effects in the body than highly, like, one thing, like a curcumin pill is different than a turmeric pill, right? Curcumin is what science thinks is the active ingredient for inflammation in the body in turmeric. However, turmeric also has a lot of other things. If you take too much curcumin, you could get diarrhea. It doesn't happen that way often with turmeric. So what you want to do is you want to take botanicals because they are, I believe that the plants are here in a symbiotic relationship with us, and they have everything that we need. I know that's a little woo-woo, but that's what I believe. And so I tend to take whole plant medicine rather than extracted and compounded remedies. All right, moving on. Antibiotics.
Lily,
Oh,
before you move on, there is a question in the chat about the soaks. Would any of these soaks be good for neuropathy of both feet that this person's had since chemo in 2020?
yes. So neuropathy or nerve pain can be treated in a couple different ways. So yes, there are nerve tonics and nervine sedatives. That's what we call them in herbalism. They work on the nervous system to strengthen it, but also to sedate it and stop those pain signals. I would definitely say a foot soak, not just with Epsom salt, but with things like hops and lemon balm and chamomile, can really help to bring down those pain responses in the feet. Yeah. And it's a non-invasive way to do herbalism. You can just soak your feet in one of those little basins while you're watching TV or doing cross stitch or whatever it is that you like to do. So that's kind of nice. Yeah, so antibiotics, we overuse antibiotics like crazy in this country, and it has led to antibiotic resistance. There is MRSA ever present in hospitals now. In fact, my partner who has diabetes got MRSA first in the hospital when they were being treated for ketoacidosis. And it's just something that we have done to ourselves. We've created these superbugs. They're resistant to most over-the-counter antibiotics, and sometimes we have to use the really big guns. And the more we use the big guns, the more they're going to become resistant to those too. So I'm not a big fan of these antibiotic ointments or antibiotic infused plastics. They do it on changing tables and cutting boards. You don't want your food in contact with antibiotics because it'll kill all your probiotic gut flora. You don't want that. So avoid anything that is antibiotic, including soaps, because soap kills bacteria anyway. If you wash your hands correctly, you do not need an extra bit of triclosan or any of those other antibiotics. Also, these ointments tend to use petroleum and other toxic products. Who wants that on their body? I don't. And again, they're losing effectiveness. So there are herbal antibiotics that are not contributing to resistance. And because they're less used and bacteria are encountering them less frequently, they tend to be more effective than these ointments. So salves like Boo Boo Balm. Boo Boo Balm is for cuts and scrapes. You put it on there before you put your bandage on, and it not only treats potential infection, but it also helps to heal the wound. No petrochemicals in it. It's oils, botanicals that are infused in those oils, and beeswax. And beeswax in and of itself is medicinal. So I use these. I have a ton of different kinds of salves in my house. I have one for burns. I have one for cuts. I have one for fungus. Like if you've got, nail fungus, or you've got athlete's foot or something like that. There's just so many different ways to use a salve. But yeah, antibiotics, you don't need them in your house. Next class of drugs that I want to talk about are PPIs, proton pump inhibitors. Now, if you've ever had acid reflux or you're in danger of getting GERD, I'm sure your doctor has recommended these. But I want to tell you that they've never been studied for long-term use. And long-term use is problematic. It causes so many problems, which, I've listed here. Organ failure, risk of fractures. If you're already, someone who has osteopenia or osteoporosis, you definitely don't want to be reliant on these PPIs. And they take away your gut's ability to do its job. So again, these are drugs that were never recommended for long-term use, and yet doctors recommend them, and you don't see your doctor again for years. And, you just continue taking them thinking that they are safe, and they have never been studied. And what we're seeing is that there are problems. So I would avoid PPIs at all costs. Instead, one of the reasons that Americans have more digestive issues than any other nation. In fact, 25% of all doctor visits scheduled are because someone has digestive issues in America. So the reason we have so many digestive issues in this country is we don't eat correctly. And one of the things that we are missing is bitter. Americans like sweet. They like processed. They like carbs, which turn to sweet. We avoid bitter. We think of bitter as being bad, right? But frankly, we need bitter food. Other cultures have bitter foods and bitter drinks. And if you're asking yourself, well, what's a bitter food or drink? You definitely need bitter because you don't even know what it is. So we need bitter in our diet. We have bitter receptors throughout the entire digestive tract, as well as in our brain and in our lungs, which tells us that we were evolved to eat these things, that they are necessary. And when they are stimulated by eating bitter food or taking digestive bitters, they enhance proper functioning. So when the bitter receptors in the pancreas are stimulated, it produces insulin and enzymes. When in the stomach, it produces the right timing of acid and enzymes. When it's in the small intestine, it stimulates proper nutrient absorption. You know, like all of these things along, and in the liver, it produces proper bile. So we want to have regular bitters in our diet, and we don't. So Haven makes a digestive bitter formula either as a straightforward tincture, which is alcohol and water, or in a vinegar solution, because vinegar also extracts those bitter constituents. You take it 15 minutes before meals, and it stimulates those bitter receptors. You'll know it's working because your mouth will start watering, right? Because it triggers those salivary gland things. What it's doing is it's priming the pump, right? It's getting ready to receive food. The thing about digestive bitters is it's a two-part formula. It's got the bitter part, which you need and as a tonic, but it's also a digestive, which makes it also a remedy. So if you overindulge, say on Thanksgiving, you know, and you've overeaten and you're feeling, oh, you know, like your gut is just like, no more, I surrender. You can take digestive bitters, and it's going to get rid of that gas and bloating, and it's going to help move things through so that it doesn't just sit there like a big lump. It is actually good for you, this digestive bitter formula. And the more you take it, the more optimized your digestive tract is. So it is great to take on a regular basis. And if you are one of those people that tends to be sensitive to a lot of different kinds of food, I would highly recommend incorporating bitters into your diet, because studies show that the more you take it, the less reactive your gut becomes to foods. So it accepts them and is able to process them better. So digestive bitters is a thing that I would recommend to anyone on PPIs to get them off. And there's other things depending on the reason for your digestive issues, but that's more for a clinical visit.
And Lily, before you move on, there's a comment in the chat that says,
Yeah.
20 years ago, those used to be only, I apologize, 20 years ago, those used to be only approved for 3 months use by the insurance companies.
Right. Because the insurance companies are in the business of making money, and they don't want to have to pay out a bunch of money for a chronic condition that was caused by a drug. Right. So they're like, boom, 3 months, that's all you get. And the thing is sometimes you need a pharmaceutical to shut down something very quickly, but it doesn't work as a long-term strategy. For example, steroids, right? If you're having a huge reaction to something, a doctor will often prescribe steroids to shut that reaction down in your body. However, if you're not doing things to eliminate the cause of whatever flared you up, the steroids aren't really doing anything. They're masking a problem. And then as soon as you go off the steroids, the problem comes back, right? So it's really important that if you go to the doctor and they prescribe something to you that is a symptom management solution, say, great, how long am I supposed to take this? And what am I doing to treat the underlying cause of my condition? Like, that is a question that will probably floor your doctor, but you do need to ask it, because in this system, we are in charge of our health, right? The doctors have to follow what the insurance companies want, and the insurance companies, they call all the shots. But you need to be an advocate for your own health. It's exhausting, but that's the way our system works. So to summarize about the digestive system, eating healthy food, and I have a whole class on that, which probably is later this year, taking digestive bitters and slowing down when you eat. Do not eat on the run. Do not go through drive-throughs and eat in your car. Literally chewing and swallowing and savoring. Those 3 things can eliminate a lot of digestive problems. So consider doing those things to stay healthy. The next most common thing in medicine cabinets are allergy medicines and antihistamines like Benadryl. So what these do is they shut down the histamine response, which is an immune system response, if you're not aware. So the reason that we get congestion and sneezing and itchy, watery eyes and sinus headaches is because your body thinks that the pollen or the pollution or whatever it is that it's reacting to is a pathogen. And the mucus is produced to trap that pathogen so that you can expel it. Your eyes start watering and itching to flush that pathogen out of your eyes. So while it's uncomfortable, it means your body is working. Now, is it reacting to the right thing? No. But it is working. And so shutting down the histamine response is a symptom management strategy. And don't get me wrong, I suffer from hay fever too. Those symptoms are terrible. But you don't want to be reliant on synthetic allergy meds and antihistamines. You want to start incorporating more tonic herbs that have natural antihistamines in them because they're healthier for you and they don't have steroids. If you're taking Flonase or Nasacort, those are steroids and they're never meant for long-term use. Snorting steroids every day, I don't recommend it. So what you want to do is you want to think about taking formulas that have herbal antihistamines and decongestants and possible itch relief. So I've listed some here. In the Haven formula, so we have a tincture and we have a tea for upper respiratory allergy symptoms. Stinging nettles, definitely in there. One of my favorite plants, super healthy for you, very nutritious. Eyebright's in there, reishi's in there. I also put mullein in mine to help expel excessive phlegm. Those things can be taken. I usually take my allergies during my season first thing in the morning, and then I wait to see if I need it again. I'm on a really bad pollen count day for the pollens that I'm allergic to. I may take it a couple more times, but I take it regularly. And the other thing is my child takes allergies proactively, because if they don't during their season, they will get congestion, and then it will trap things there, and they will get an earache and an ear infection, and those are super painful. So I give it to my son regularly to avoid that situation. All right,
Lily,
see.
there's a question in the chat. What
Yeah.
about epidural steroid injections? Just a temporary fix? Any
Yes.
advice on that?
Yes. So yes, steroids are always a temporary fix. They shut down pain and inflammation. But what we need to do is, again, we need to fix the root cause of the pain and inflammation. So not knowing what your issue is, I will talk about one of mine. I have, what's the word? Shooting pain down my leg. What is it? Begins with an S.
Sciatic?
Thank you, sciatica. Why can't I think of the word? I don't know. So I get sciatica, and there's two different kinds of sciatica. There's the musculoskeletal misalignment, where like the pelvis is misaligned slightly and it pinches that sciatic nerve and causes pain. And then there's also inflammation sciatica, which usually the piriformis muscle, which kind of lays over that nerve underneath the gluteus maximus, will get inflamed, and it will press on it and cause the pain response. I have that kind where if I do a lot of bending over and lifting and moving around work, my piriformis will get inflamed and it will cause sciatica, usually later that day or the next day as I'm recovering. So again, the turmeric is a lifesaver for me, because it means that I can do more of that work without flaring up that inflammation response in the piriformis muscle. So that helps me, but getting to the underlying cause and helping to fix that underlying cause will help you not need the steroid injections as much, right? Now, I'm not saying don't take them, because when you're in pain, it's terrible. But if we can eliminate the root cause gradually, and we can see if other types of treatments help deal with your symptom management, that will also help you to keep your endocrine system in balance. Because the way your endocrine system works is there are hormones that are produced in your pituitary gland, which are precursor hormones, and they signal all the glands in your body, your thyroid, your adrenals, your pancreas, to create hormones of their own. It's a series of cascades. And if you are introducing steroids from outside the body that don't have its origin in the pituitary, it can really throw things off. It is a balance, your endocrine system. So I do not recommend taking steroids whenever possible, and definitely not taking steroids frequently. Because it can mess up your endocrine system. And when you mess up your endocrine system, you mess up lots of things. We don't even have all the data, but I will tell you that your endocrine system regulates every function in your body. It regulates your body temperature, your ability to process food, not just your reproductive and sex hormones, but also your ability to have stamina and focus. You can become very brain foggy, very fatigued. You can start getting thyroid issues. Like, long-term steroid use is just not great. And if you don't have a choice, choose a pain-free life. But if you do have a choice and you can start investigating those choices, I would definitely do so. I hope that answers your question. Yep, sciatica, I know, right down the leg. Yeah, so the other thing that tends to be in people's medicine cabinets are body care, right? Deodorant, toothpaste, lotions, things like that. And I do a whole class on body care as well, but I'm going to mention it here. First of all, deodorant and antiperspirant. Number one, always avoid antiperspirant, always. Sweating is a natural bodily function that you need to do to release toxins from your body. And avoiding sweating in a certain area just causes those toxins to accumulate there. And I just want to point out that the lymphatic tissue that is here underneath the arm is also very close to the breast tissue. And it can cause stagnation in that lymphatic tissue and spread into breast tissue. I will tell you that the parabens that are very present in a lot of commercial deodorants and antiperspirants have been found in biopsy breast tumors. You want to avoid any ingredient that is a paraben, which is DEA, FEA, anything that says methylbutyl peril in the prefix of it. And if you are not sure if something is toxic or not, EWG.org, environmentalworkinggroup.org, has a great database of cosmetics and body care called Skin Deep that you can research the product and the ingredient. It's very comprehensive. Again, that's EWG.org. I'm going to put that in the chat, EWG.org. Oh, no, it said egg because it auto-corrected me. Ignore that one. EWG. No, not egg. No, not egg. EWG.org. There we go. That's the second link. Egg. No. Anyway, so checking out what is in your medicine cabinet now, finding out if it has an F rating or a D rating, check those out. You don't want to put those on your body because what you put on your body is the same as putting it in your body. Your skin absorbs 75 to 90% of what you put on it. So make sure that what you put on it is clean. So yes, with deodorants and antiperspirants, choose a natural one. All the ingredients should be pronounceable, right? If you don't recognize an ingredient, look it up on EWG.org or shoot me an email. I will let you know. Toothpaste. So we got used to an idea of toothpaste, right? Squeezing it onto our thing. But honestly, the easiest way to avoid toxins is to focus on tooth powders or tooth tablets rather than pastes. When you have moisture in something, you need to stop the natural processes of decay and breakdown that come with liquid being in a product. And what that means is fungicides and parabens and all kinds of toxic preservatives. So really, if you focus on tooth powders or tooth tablets, you're going to avoid all of that issue. And you just put it on your brush and do it that way. Or if you have a little tablet, you chew it so that it becomes a powder in your mouth, and then you brush your teeth. They work really well. You don't need to use a toothpaste. Mouthwash, you really want to avoid Listerine. They've banned it in Australia. It causes lesions and cancer subsequently in the mouth. So using a mouthwash that is natural, and don't necessarily fall for greenwashing, right? A lot of these natural companies like Burt's Bees or Tom's of Maine, they're now owned by big companies like Unilever, Clorox, and Procter & Gamble, and it's just greenwashing. They've changed those formulas from when they were little indie companies to be really cheap and mass produced, and they have all kinds of ingredients in there that you don't want. A gum and mouth rinse that you could use. Haven has one. It has like 5 ingredients in it. It is very basic, but it tightens up the gums when they get loose. It kills pathogens, and it stops bleeding. So you can make an easy rinse using apple cider vinegar, and some essential oils that you put in a little bit of alcohol, not a lot of essential oils. Again, you want maybe like a 2% dilution of whatever oils, like tea tree. Myrrh is a good one because it helps to facilitate gum growth. Yeah, but you definitely can make your own, much cheaper and better for you. And you can package it in glass, because plastic, that's the other thing I want to say to you, is that a lot of these products are packaged in plastic. Now, we now know that we all have microplastics in our bodies, right? And it's in the environment, and it's causing all kinds of health problems, a lot of them yet unknown. Anytime you can avoid plastic, you should. I know that that is difficult in the United States, but buy produce that is loose and you bring your own little bags, right? Like they make these little net bags that you can put your produce in. Avoid plastic packaging. And that means possibly buying from a small company to get your body care, possibly making your own. I give out recipes during the body care class so that you can make your own. But your things that go in and on your body should never be packaged in plastic. Just gonna put that out there. Lotion is a huge culprit for toxins. The reason that Haven does lotions only by pre-order is because we don't want to put toxic preservatives and shelf stabilizers and fungicides in it. So what we do is people order it, and once a month I make all the lotions that we're going to make for that month. And that includes body lotion, face serum, sunscreen, and magnesium lotion. Like those are the lotions that we make. I make a big batch of it and we ship it out immediately. And it's a month supply. And we have some natural preservatives in there, some radish root ferment, for example, that will keep it fresh for about a month. And we package it in a month's supply. And we do that, and we go to all that extra administration and labor because we don't want to poison you. So when you buy the lotion off the shelf at the drugstore or the grocery store, first of all, it's packaged in plastic. Second of all, it has so many chemicals in it to keep it preserved until it gets to your home. So it gets made, and then it gets boxed and put in the manufacturer's warehouse. And then from the manufacturer's warehouse, it goes to a distributor's warehouse when the distributor orders it. And then from the distributor's warehouse, it goes to the retailer's warehouse where they store it. And then from the retailer's warehouse, it goes to the individual store when they order it. And then eventually it goes from the back of the house to your shelf. And then eventually you pick it up and take it home. And it's this massive bottle that you're never going to get through. It seems to take forever. Think about how long it takes for a cup of tea to sit on your counter and get mold growth. Probably 2 days, right? Like you all of a sudden you see a little fuzzy if you forget to do the dishes. 2 days. And this is probably months to a year old, this lotion. What must go in there to stop nature from its own biological processes? Because there is water in there. It's usually the number one ingredient, which means everything else is going to break down if they don't put these chemicals in there. So yeah, we only do lotion by pre-order because we want people to have clean lotion. Facial cleansers and treatments, people often have these in their medicine cabinets. If you need an exfoliant, there's so many things that you can gently exfoliate with. I make one with almond meal. It's very gentle and moisturizing, not too abrasive. Like when I was a teenager, they had this one that you would buy in a tube, and it was like apricot kernels. I don't know if people remember that, but it was like lacerating your face. But I was a teenager, so my skin could handle it. I would not be able to do that now. But I make one with almond meal, and it exfoliates, but very gently, and it's very nice. So you can buy almond flour pretty much anywhere these days. And, you know, mixing that with some clays or botanicals and using that to exfoliate your face. I use moisturizers almost every day, on my face every day, and on my body every other day when I shower. So I have like a oil that I put on my face, because, you know, I'm dry now. I'm of an age in which my skin is dry. And so I do that every day. And it's just oils and nothing else, right? Like I just go ahead and do it, and it absorbs into my skin faster than you could ever imagine, because again, I'm a dry person. But I use those instead of like the over-the-counter serums that have like 50 ingredients in them, half of which you can't pronounce. And then acne treatments for our folks that are still prone to acne, using spot treatments coupled with liver cleansing herbs that you take internally can really help clear up the skin, whether it's hormonally based or food based, or something having to do with closed up pores. All of those spot treatments will help in the area, and then cleansing the liver and keeping it cleansed. The digestive bitters are also liver cleansers. So you're doing a double duty there if you're prone to acne. The skin is an organ of elimination, and so it's the last one in the body. So if you are seeing eruptions, boils, acne, things like that, it means that your liver is stagnating and you need to cleanse it. And usually the problem gets a little worse before it gets better, because there's the last little bit coming out, and then you'll see a resolution. So resources for DIY. Hopefully I haven't completely overwhelmed you with all the things that you should probably avoid, but here's some proactive advice. Looking at different websites to do some research, as well as getting some ingredients to help make yourself some stuff. So in terms of research, EWG is my favorite. They do lots of work, and they have compiled so much for you, and it is all free for the taking. Safecosmetics.org is also a really great website. If you want recipes to start dabbling and making your own in your kitchen, the Mountain Rose Herbs blog is great. It's also where you can get ingredients. And Herb Rally has a really great blog with some recipes on it. In terms of getting botanicals, my number one is Mountain Rose Herbs. They are sustainable, mostly organic. And if it's not organic, then it's ethically wildcrafted. You can get as little as 4 ounces of an herb, but as much as multiple pounds. Star West is also on the West Coast. They're my second favorite. And then locally in Ohio, in Columbus area, you can go to Clintonville Natural Foods, and they have a bulk section, and you might be able to find what you need there. Butters and oils like shea butter, or precious oils for your serums. Mountain Rose Herbs is still my number one. Bulk Apothecary is my second. And Earth Elements is a local one in Grandview that they sell oils and essential oils and such. And then essential oils, I'm not a huge fan of essential oils, but I do use them in some formulas. You're going to want to dilute. if you are making a spot treatment, like just for your face and neck, and you're going to use it every day, 2% is all you need. And if you're doing a full body lotion and you're going to, you know, put it all over your whole body, 1%. You really don't need a lot. They're highly concentrated substances, and they're, your body will become overloaded with too much if you overdo it. So again, essential oils, dilute please, either in oil or alcohol. That is the only way to dilute them. You cannot dilute them in water. They will just pool because they are hydrophobic. So oil and water don't mix. Dilute in oil or alcohol. So that is that. And you will get this slideshow so that you'll have all those websites and names of businesses that I recommend. And the last two businesses, havenherbs.com, that's my little worker-owned apothecary. lilykunning.com is where I teach classes as well as do clinical coaching and visits. And that is my thing. And we have a few minutes left for more questions.
So Lily, we have a question in the chat that says, my husband has a pituitary tumor and needs to take meds to replace what he can't produce on his own. Any herbs or tonics that would be beneficial?
So that is a very complicated situation that requires case management. And so herbs don't treat conditions, they treat people. And so what we do is we create a formula specifically designed for your husband, their symptom manifestation, their constitution, their current condition. And that may change over time, right? Formulas can change as different conditions progress. So I highly recommend, rather than just like throwing out a few herbs the way the internet does, seeking a clinician to make sure that it's being done correctly. And that everything that is currently being done is being taken into account, right? If your husband is on pharmaceuticals, that needs to be taken into account. There's certain herbs that don't mix well with pharmaceuticals. So please seek out a clinician and they will do an intake. There'll be like a long form that you fill out, and they will spend, you know, a good hour asking questions and coming up with a strategy. Yeah, so
Then we have a question about, what about I apologize. What about teeth whiteners?
Sure. I don't recommend synthetic ones, but there are plenty of things that can help whiten your teeth. Haven makes a tooth whitening powder, tooth powder called Black and White, and it has activated charcoal. So the formula looks black, but I promise you it will whiten your teeth. You know, baking soda is a mild abrasive. Don't use too much of baking soda in your formula if you're going to make one on your own, because it can be too abrasive for people with thin enamel. And if you mix baking soda with a little bit of citric acid, you'll get like a chemical reaction as you're brushing your teeth, lightly foamy. And that really helps to remove stains as well.
And I think this might have answered the next question. What do you think of charcoal toothpaste?
Charcoal toothpaste does whiten, but again, I would avoid pastes if at all possible, because again, the liquid element of that formula means that there has to be some preservatives in there that you're probably not going to want in your body. The other thing is that most toothpastes are now packaged in plastic tubes and not metal tubes. And so you're getting microplastics in your formula.
And then what do you use for sunscreen?
For sunscreen, I make my own sunscreen, of course, right? Yeah, the herbalist makes their own, but it's a Haven Herbs product. It's called Beau Soleil. It has 5 ingredients. The thing to know about sunscreen is that not all of them are safe. Some of them have endocrine disrupting chemicals in them. If it's over 30 SPF, it's immediately suspect. Do not buy anything that's over 30. All those 50 SPFs, first of all, there is no evidence that they protect you better or longer. Second, those chemicals only protect against UVA. They don't protect against UVB. And third, those chemicals disrupt your endocrine system. So we use a mineral, zinc oxide, to create our sunscreen. And there are 4 more ingredients besides zinc oxide. It is unscented so that people with sensitive skin and babies can use it. It is very effective. But what you want is you want a mineral-based sunscreen, preferably zinc oxide, and the zinc oxide needs to be non-nanoparticle. What that means is the particles are large enough that they sit on top of the skin and act as mirrors rather than absorbing into the skin or into the pores because the particles are too small. So non-nanoparticle zinc oxide based sunscreen. There's your answer.
And then we have, I have been using coconut oil instead of body lotion while going through chemo. I don't use it on my scalp because I don't want to clog the follicles. Is that okay?
Yeah, coconut oil is perfectly fine. I personally find it a little too oily. Like coconut oil, when it is in its natural unrefined state, starts melting at 78 degrees. So obviously your body temperature like immediately liquefies it, right? I find it just a little too oily. I prefer something like shea butter. But coconut oil is great. And again, all these natural products are only as good as where they're sourced from and how they're processed. So if you're going to use coconut oil, the brand that I really, really like is Dr. Bronner's. It is fair trade. It is clean. And you know that they did a good job. And it's also packaged in glass, which is important.
Is there an alternative to taking Metamucil daily?
It depends on the reason. So, if you are constipated, there are lots of reasons for constipation, and we need to get to the root cause of what that is. And I'd be happy to work with you to figure that out. But Metamucil is a natural product. It's psyllium husk, although there may be some added things. You could probably just get psyllium husk by itself. Obviously eating foods very high in fiber. Most people don't get enough fiber. They're not eating enough vegetable matter, is one way of avoiding supplementation of fiber. But, you know, psyllium husk is plantain, which grows in the cracks of your sidewalk. Plantain, not the banana, plantain, the herb. If you Google that, plantain herb, you'll see it. You'll recognize it. Even if you don't recognize the name that I'm speaking now, you'll be like, oh, that thing? The seeds from the plantain are psyllium. So it is a natural product. You could actually, if you don't spray your yard and it's people aren't spraying around you, you could harvest your own because it grows everywhere. But yeah, what I would say is constipation is a symptom. Let's figure out what the root cause is and work on that while you are taking your fiber supplement and gradually make it so that you don't need it anymore.
And then any ideas for combating hair loss?
So hair loss is a symptom. I know I'm a broken record, but hair loss can be caused by so many things. It could be caused by hormones. It could be genetic. It could be part of an illness. It could be part of cancer treatment, right? And so there are different approaches for different root causes. And, you know, at the same time, to regrow hair, there are lots of topical treatments and internal treatments that you can take to start doing that again. But until we look at the root cause and figure out how we stop that particular condition, it will keep happening.
And then I believe, and if I am reading this question incorrectly, Cheryl, please correct me, but I believe she's referencing, do you provide the consultation? And I can say on a personal testimony, yes, she does. I actually worked with Lily on a personal consultation for some of my own health issues, but I will let you fluff that answer out more, Lily.
Yeah, if you just go to my website, there is an appointments tab and you can click on availability and book an appointment. The way that works, herbalism is very different than modern medicine in a lot of ways. So what's going to happen is you'll book your appointment and there will be a link provided for an intake form. It takes about 20 minutes to fill out. I won't kid you. But I need all that info to get a holistic picture of what's going on with you. After that, I will read it, and then prior to our appointment, and I will start interviewing you and asking you questions and getting more detail. And we will come up with a wellness plan together for whatever it is that you're working on. Once that is set, I send you a follow-up email outlining the whole thing, so that you don't have to remember it, like it's all there in writing for you. I will also give you additional resources, and if needed, I will create a custom formula for you, and send that to you. That will likely be a tincture, which is a liquid extract. And usually I give people a month supply and then ask them to check back in with me in a month so that we can monitor progress on the situation. But of course, at any time, if you have questions or concerns, you would shoot me an email and I would get back to you in that in-between time. But that's how a clinical relationship works in herbalism. Yeah.
Okay. I don't see any other questions. Lots of thank yous.
Thank you, everybody. It's always a pleasure to chat with folks at Cancer Support Community. I love what they do. They have so much amazing programming. So definitely fill out those feedback surveys so that they can get their finances to continue doing all of these free classes.
Well, thank you so very much, Lily. You know that we greatly appreciate you sharing your time and your wealth of knowledge and expertise with us. And in July, on the 25th, Lily's going to be presenting again. This time the session will be herbal pain relief. So please join us at the end of July for another natural living workshop.
Bye, everybody. Have a good day.